We're going to get to the final portion of our workshop. I know that Dr. Smith and Carol talked a little bit about dental issues as regards the Gerson therapy before. And one of the things that you may have noticed, although they didn't come right out and say that, is that they don't seem to have the greatest respect for the vast majority in the dental business because of a lot of things that they have done that have been very harmful to people. With the best of intentions, many of them, but inadvertently through just bad knowledge that's been passed on for a long time. So we're very fortunate to have one of the good guys here who does not represent the majority of those in his field and who does actually recognize that the mouth is part of the greater human body and not something completely separate from it. So please welcome Dr. Daniel Vinograd.
Thank you so much. It's great being here once again, and it's not once again for you guys, because it's probably most of you guys' first time here. But where are you guys from? Can you more or less give me an idea? U.S. mostly? Louisiana? Oh, wonderful. Okay. Great, great. Awesome. Well, you know, it never ceases to amaze me how people from all over the globe will come together when they have a certain commonality. And so I'm very, very pleased to be with you guys today. And I'd like to start by talking a little bit about the internet. And why am I starting this talk about the internet? Most of my patients, the first-time patients that come to see me, have done a tremendous amount of research, mostly on the internet, right? And so the internet is a fantastic tool for us to gain information. However, we gain a lot of really good information from the internet, and we get a lot of really bad information from the internet. So, you know, we used to always say, they said this, they said, well, who is they, right? Same thing on the internet. Who is they? Who's writing all this stuff? And over the years, the people that are actually dominating the internet have gotten quite sophisticated. You have very, very smart people now helping people dominate the internet. So who's dominating the internet now? People that are savvy about how to work the internet. So the information that is apparent on the internet is not always the best. But how do we know what is good information and what is bad information? And that is the key. Does that mean that we say, no, internet is evil, I'm never going to go back there again, you know, because they got a bunch of lies and bad information? Of course not. But it is really important for us to have awareness. And the awareness, you know, I get patients coming to say, Doc, I read this on the internet, like, you know, this absolute. And so we have to backtrack a little bit and say, well, where is the information coming from? How does that fit into your reality? And so the most important thing that I want to do today, if I'm successful, is to give you some tools so that you guys can all make sense of what you're reading. And you can make your own mind as to what is good information and what is not. And when you don't know, that you can ask the right questions and that you have enough solid knowledge of what it is that you're going to learn, not only to trust people around you. When you start hearing them talk, you can start separating reality from fiction. You can start separating people who are giving you information versus people who are trying to sell you something, right? And so most importantly, when can you really trust your own instincts, which is an incredible source for each one of us, right? We have an incredible amount of evolutionary intelligence in each of our bodies that we can tap into. And so I would encourage you to tap into that, you know, don't disregard your instincts. And also, you know, start trying to understand who it is that we can trust and who it is that we can't. So I practice what I call biological dentistry. And what do I call it biological dentistry? Because, you know, there's holistic dentistry, and there's amalgam-free dentistry, and there are all these terms that have been coined. But bottom line, a dentist will see himself either as a business person. I know a lot of dentists who are basically just business people. Some of them get large clinics and manage them. I'm not judging anybody. I'm just, you know, basically identifying that they are mostly interested in the business aspect of it. I know a lot of dentists who are incredible engineers. They're technicians. They can do a lot of really fine work. There are other dentists who are incredibly caring human beings. And there are all the combinations above. But in my view, what is a dentist? A dentist really should be a healer, right? A dentist should be a person that is helping you heal and that is treating you like any other specialist with a certain part of your organism that is actually connected to everything else. So you know, for us, and I tell you, when I came out of dental school, I was treating mouths. I wasn't treating patients. I was treating mouths because this is the focus of my training. My training is you have tooth number 18 MOD. This was the lingo. You have, wait a second. Did we forget that there's a person behind that? So over time, you know, I have to be honest with you, when I first started practicing dentistry, it was very dissatisfying to me until I finally realized it's not about a crown. Of course it is about a crown, but it's not just about a crown. It's about treating a person. And how is this crown going to affect everything? So having said that, I will talk a little bit about what is happening with dentistry as a whole. So from its inception, dentistry has been looking at the repair business of the mouths. So how do we repair a mouth, right? How do we actually take care of a broken tooth? And that was a big challenge because the materials were really not great. And so the biggest challenge was, how do we get something that's strong enough? I mean, can you imagine the forces that we put on a mouth? Masticational forces, that's tremendous. You know, and if you ever had a high spot in your mouth and between your upper and your lower teeth, you know that can get sore in a hurry because you're putting an incredible amount of pressure in a very, very, very small area. You have a lot of muscles, you have a lot of functional apparatuses that are working towards really grinding the food down. So it's very challenging to actually get a material that is going to withstand for many years the masticational forces. So a lot of the people were really talking about materials that are strong, that resist friction, that resist compression. So this was, I had a very good friend who was the head of dental materials at UCLA, University of California, Los Angeles. And I would always hear him talking about, you know, all the research that's been done about the elasticity of this material, about how this material compares to the expansion and contraction of the tooth, et cetera, et cetera. And, you know, there was really no regard at all to the physiological effects of what we were putting in people's mouths. I understand where they're coming from. You know, they had this huge challenge from an engineering point of view, and they're just putting all their energy and their focus into it. Unfortunately, again, we were forgetting we are talking about human beings. Case in point, you know, dental amalgams that are 50% mercury. I will talk about that a little bit more. You know, they were actually trying to see how they could actually take a child's tooth and treat it so they can maintain the tooth after the nerve has been infected. The solution? Formaldehyde. It's called formocresol, highly cancerogenic, still being used today, but it actually mummifies the nerve and the problems go away. Obviously, we're creating a huge amount of new problems when we start using a lot of this. Root canal sealers were among the most toxic materials as well. And we fail to see that, you know, the connection between the mouth and the rest of the body is really affected by a lot of the materials that we use. And also by the bacteria that we have in our mouths. A great deal of information today about how bacteria in the mouth affects the rest of the body, and I will talk about that as well. I will start with mercury amalgams, because this is something that I think has been out on the media quite a bit, and it's really affected a great number of us, right? Has anybody here had amalgams placed in their mouth before? Right? So just look around you, just about everybody. And why were those amalgams placed? Again, they were amalgam is a wonderful material if you're just looking at a robot, you know, where you're actually going to put something in that works physically. In 1833, there were a couple of French guys that came over to the US and brought amalgam the first time. And then in 1844, the amalgam was just widely used. In New York, it was used as the restoration of choice. There was a great group of brilliant people, the American Society of Dental Surgeons, that came out, and we're talking about, you know, 1844. We're not talking about 2010 or 2013. And they said, wait a minute, you know, this amalgam is filled with mercury. It's 50% mercury. And so they actually were the most prestigious dental group in this era. And they actually said, if you want to belong to us, the most prestigious organization, you have to sign a contract that we will not use amalgam. Brilliant. Here are our first heroes, right? You could put a cape on them, right? And a big S here, or whatever you want to put, a big D. But unfortunately, in 1856, they were disbanded, and the American Dental Association was founded, and they were a little bit of an opposition group, which really was proactive in promoting dental amalgam. There was a large group within them that was the American Amalgamist Association that was really driving a lot of this amalgam proposing. You should know that mercury is one of the most toxic elements known to humans. And I think most of you know that. And when you think about 50% of the amalgam is mercury, it's mind-boggling. But you know, people that are proponents of amalgam say, yeah, but you know, the amalgam gets fixed. It gets set with the silver and so forth, and so it becomes inactive. I'm not sure I buy that. And even if I would buy that, I'm not sure I would put it in my mouth or anybody that I cared for, or any of you guys' mouths, just in case they're wrong. Here is from the Department of Health and Human Services. They are actually considering mercury to be the third most toxic material known to man. This is not me. This is not some kind of a health-oriented healer talking. This is the government of the United States. So in the 70s, yeah, I go back that far, in a little more. In the 70s, I started asking my colleagues, guys, this is 50% mercury. Are you concerned at all that you're putting this in people's mouths? And, you know, most of them were good people, honestly, good people, well-intended people. A lot of them came out, you know, wanting to help people out in a healing profession. So I don't think there was a lot of malintent or maliciousness in saying, oh, I'm out to poison people. But a lot of them were just, the mindset was different, you know? The mindset then was, anybody who's proposing that amalgam is toxic or shouldn't be used is a quack. And this is mostly what I got from them when I spoke with them. So you don't have to take my word for it. You don't have to take even the government's word for it. Just ask your dentist to read the labels on the packaging from the amalgam manufacturers. It scares you. If you read that, it really scares you. It talks about toxicity, how it can affect your nervous system, your liver, your kidneys. State of California, for those that you are from here, you know, we have now a proposition where a dentist has to disclose to a patient, if they're going to use amalgams, that there could be birth defects, especially for women of childbearing age. And this is what I see in my office every day. And people say, but doc, I've had these amalgams in my mouth since I was 12. Yeah, I know. I know. And so some of the problems with the amalgams, when they're first placed in, the fresh amalgam, the fresh mercury, is very, very active. This is when I'm most concerned. There's a period that could be called a period of inactivity, relatively speaking. I think it's always a problem to have those things in your mouth. And then as the amalgams start getting older, the amalgams start oxidizing, the margins start opening up, and the amalgam has a tendency to swell up with time. What does that happen? Just from a mechanical point of view, forget about the biocompatible point of view, they start actually cracking, creating cracks on the teeth. Again, I must do a few crowns a week from people that have had amalgams and have had cracks from the amalgam swelling. So even if you don't feel that this is a problem with your health on a biocompatible kind with a biocompatible kind of perspective, just from a physical perspective is not a good material. So I think those are incredibly toxic restorations. So if any of you still have amalgams, I would take a look at them, see what they look like, talk to your health practitioners about them, run some tests, you know, see how toxic you are with heavy metals. Those are a lot of things that could influence your health. Now, this is what I find under the amalgams. That's very typical, very, very typical. You can see on this side what the amalgam has created. That's after the amalgam has been removed. It's actually interacted with the tooth in a significant way. And you can see on your right, you can see the crack line. Very, very clearly there. See between those two spaces? That's very typical, and we see that often. This is not a seldom case. This is something that we see all the time. So, you know, after we've restored the teeth, obviously much cleaner, much healthier, and obviously the opportunities for those teeth to be lost due to cracks diminishes tremendously. So a lot of people that come to the office ask me, well, doc, okay, I get it. I really shouldn't have the amalgams in my mouth, but what do I do? How do I take them out? And I often talk to them about how would you take any toxic material out of a building? Asbestos was big, right, in the 60s. And in some buildings, they have special people that come and actually take the asbestos out. So there is a certain protocol as to how we can take the amalgams out of your mouth and how we can do it safely. That's very, very important. To have your amalgams taken out in an unsafe way, it really subjects you to have a lot of that material reintroduced to your body and lodged in some of your fatty tissues, like your liver, like your brain. And so a lot of people that have gone to the internet have read and asked me, well, doc, what kind of protocol do you use? Do you use HYGIENE's protocol? Do you use the International Academy of Oral Medicine and Toxicology? Do you use, I don't know, you know, there are probably 7, 8 different varieties. And all of those protocols are good, but here's where you have to start thinking, and there's where you have to start developing trust in your health professional. And a lot of the times, because we get so involved in our head and we forget to really feel or trust or really get guided by something other than just our thoughts on the internet, we tend to choose the person who has the best protocol. But really, you don't take the eye off the 8 ball. What does that mean? That the most important thing about a protocol is the practitioner behind it. How meticulous is this person about implementing the protocol? So a lot of people say, well, Dr. Huggins says you should never do this on Tuesdays and Thursdays. Well, you know, maybe, I'm not disputing that, but it's much more important that you have a practitioner that is going to put a rubber dam and make sure it seals really well. So again, you know, the important thing is that you have somebody that you can trust that will do a good job for you, that you know is meticulous, that you know has your health as their primary concern. So the basics really is that you want to have the rubber dam is the key to this all. And has anybody had a rubber dam placed on them? Right. And so a rubber dam is just a physical barrier. And in our office, we actually place the rubber dam, and then we actually put a seal around each tooth in addition to that. And then we actually pour water on the rubber dam, make sure nothing is really coming through. Once you've done that, and this is something you could ask your dentist to do, you know, could you check, could you put some water in there and see if anything is leaking before the amalgam gets taken out? And then the second part is, you know, a lot of the powder, a lot of the gas that is being produced with the heat of the drill. You also want to be protected about inhaling it. So that's again what I'm talking about is you guys just using common sense, understanding what's going on, and it's less important that you read in the internet that somebody has, you know, such and such protocol, and more that somebody's actually using oxygen, protecting what you're inhaling, and protecting what's going behind. You can read the rest. So a lot of the really proper protocol is really to segment the amalgam so you're not grinding at all and taking them out by pieces. And some people have equipment that allow them to do that. In our office, we additionally use some homeopathy and some natural ventilation, nutritional guidance, and we do quadrant dentistry. So we placed a rubber dam, and we actually remove everything by quadrants, so we don't have to be revisiting the same area over and over. And so one of the interesting things is, well, you're going to take the amalgams. You made that decision. I'm taking my amalgam out, or my amalgams out. What am I going to replace them with? And this is a very interesting part of the process, because there are basically two major ways to replace an amalgam restoration. One is with composites, and the other one is with some kind of a casted piece, and I will explain. The composites are basically powdered glass and plastic. That's what a composite restoration, those white fillings that are put in your mouth, is basically powdered glass and plastic. Most often than not, and so far in my research, I have found that just about every composite has BPAs, with the exception of one, and I'll talk about that one. And then the other possibility is the only one brand that does not have BPAs is a mix of a composite with what we call a glass ionomer cement. Glass ionomer cement is a very, very good material. The only problem with that material is that it has fluoride. Now, here I'm being honest with you. I'm talking candidly with you about what the options are. We live in an imperfect world, and you have to make good decisions. And you're going to have to make a decision. If you go with a composite, are you going to go with a composite that has BPAs or a composite that has some fluoride? No other options in the market. So when you're making your decisions, you have to really understand there are there's not a perfect world. There are no perfect solutions when you're using a composite. And as much as I am totally against the use of fluoride, there's no fluoride in my office. The effects that I've seen with BPAs are quite a bit more devastating. I think that actually the very minute amount of fluoride that is on this one material, and the fluoride stays active for a short time, and then it stops being active. What do we use? Which one of the two do we use? Well, it depends on you, your situation. It depends on your condition, or do you not want to use either? Well, you have another option, which is inlays and onlays. The advantage of an inlay and an onlay is that it's a baked porcelain, significantly more stable, no BPAs, no fluoride. Big problem with that. Yeah, they're quite a bit more expensive. Quite a bit more expensive. Now, when you have a large restoration, in my book, there's no choice. You can't put a large composite that you're going to be grinding down all the time, right? So basically that's right. And then, you know, when it comes to your inlays and onlays, there are different kinds of porcelains that you can use. There are indirect composites, which are baked composites. And then you have pure ceramic restoration, which is called a Bruxer crown. And then you have some combination porcelain inlays and onlays. So when it comes to the onlays and inlays, here are your different choices. You have porcelain. This is for inlays and onlays as well as for crowns, when you have to have a crown in your mouth. You can have porcelain fused to metal. And the different metals that you have is non-precious, and you can see what the non-precious contains, which is something that I would definitely not recommend. Precious, which people think it's all gold, and it's really great, but it also has some additional metals mixed into it. Gold by itself is a bit too soft. And semi-precious. Today, I hardly ever use metal in the mouth. I would say that would be a very rare case when I would be forced to use a metal. And in that case, I probably would use just a pure titanium. But most of the time, we don't need to do them. We have bilayer type of restorations, which either are aluminum oxide or zirconia oxide with veneer porcelain on top. Or we have pure zirconia Bruxer crowns, which are just pure zirconia crowns, which is really the advent of dentistry. This is the newest type of crown. Any of this perfect? No. And this is where I'm asking you guys to really understand what's going on so that you can make good choices. I would say if I have to use something in my mouth, I would definitely use either an inlay or onlay or crown made of pure zirconia. That's probably the cleanest material that you can find at this point. So because patients are now demanding different materials, better materials, more biocompatible materials, dentists are responding. You know, people respond to demand and supply. If people start demanding biocompatible materials will be coming through the pipeline. And so more and more dentists are abandoning the old guard. Okay. Any questions about this so far? Okay, we'll move on then. Yes? Mixing of amalgams, of metals in the mouth? You mean having one tooth with one and one with a different kind of metal? Yes, that's really not a good idea because the saliva will conduct electricity between them. It's called galvanism. So to have two types of different metals, to have metals in general is not a great idea in your mouth, but two kinds of different metals is even worse. So thanks for bringing that up. Yes?
You were talking about fillings as well as caps and bridges as well.
Yes, all of those materials can be applied to, except for obviously the composites are only for fillings, but the crowns and bridges can all be done with metal fused to porcelain, and then porcelain by itself, or powdered zirconia, which is the Bruxer crown. Those are different.
You can't use porcelain for fillings, huh?
Yes, actually, when we remove the amalgam, you have a choice of either using composite or any filling can be replaced with a porcelain piece instead of composite. So that would be the optimal, but obviously you have to factor in the cost at some point.
Dentists exposed to the mercury get some damage too?
I'm sorry?
Dentists exposed to mercury get damage?
Yeah, mercury is exposed to the mercury.
Do the dentists get
Get exposed
damaged
to the
by their
mercury.
exposure to
Yes,
mercury?
absolutely.
Years, you know?
The reason I'm standing here today is because about over 30 years ago, I felt really sick. And I was wondering, oh, God, I'm in my 30s, so this is what getting old must feel like. So, I felt really lousy. I said, okay, well, I accept. I'm getting older. And then I realized that I was incredibly mercury toxic. And so I had a lot of memory problems, constant fatigue. So this is how I really got started into becoming a naturopath and getting interested. So yeah, especially dentists that continue to use amalgam are quite exposed. Not so much now as we used to be because, 35 years ago, we're not using gloves and masks and so forth. But even today, when we remove the amalgam, so we actually protect ourselves.
How many years do you think a dentist get damaged with the mercury?
How many years?
Years takes for the mercury to damage a dentist. I'm telling this because my daughter is a dentist.
Yes.
I don't know if she's doing the same thing like you or the other thing, but
yeah, well, whatever she's doing, whether she's placing the amalgams or not, she probably is removing them all the time, every day. So she should really protect herself well against a lot of the fumes, a lot of the powder that's coming out, definitely. It's a great risk to her health. So for you to intervene or give her some awareness would be an act of love and kindness.
Hello, Doc. I have a question. It's kind of a stretch, but is there any chance of reusing, people pull their wisdom teeth out, reusing some of their own material and some growing your teeth back in some form, or using any form of material in your body, like bone of some sort that really can regrow itself into and not have to use a foreign material outside your body?
Yeah, maybe 20, 30 years, but not at this point. They actually have now developing tooth germs, where you can actually take a tooth out and place a tooth germ and grow it. That's happening already. It's just not happening fast enough, because those germs take about 7 to 8 years to grow, and most of us don't want to go without a tooth for about 7 to 8 years. But what about stem cell? Yeah, all of that is coming. All of that is coming. Unfortunately, not here for us today yet.
Do you refer any of your clients who have had their amalgams removed before and not that way to a certain naturopath or someone who can detox? Because I know I've had mine removed before and I still have some left, and my doctor never really thought they were problems, no matter how much I told him.
Yes.
And I would have pieces of it left in my mouth and he would suction it out. I would swallow some. I know.
Right.
And I know I'm feeling the effects of it every day, but is there a certain protocol?
Yes. So your experience is not unique. This is the norm. This is what happens in dental offices all the time. Not all of them. Yeah. And so a lot of the stuff that has gone systemic, unfortunately, the mercury gets lodged in some of the fatty tissues. And so they're very, very hard to get rid of. So the first thing you should do is maybe consult with I do work with naturopaths in town, and they sometimes do some chelators or some testing and so forth. But the first thing for you to do is to test yourself for, and there are different ways of doing it. There's a rough estimate of how you can do it with hair analysis. Then there are other ways where you chelate and actually you test either your urine or your feces to find out. But you actually have to, in order to do that, you have to dislodge a certain amount of the embedded toxins. Because as long as if you just take a blood test, they're not going to appear because the toxins are really embedded in the fatty tissues. So you have to take something like DMSA, DMPS, which is a little harsh, so you don't want to be doing this all the time. You want to do it with supervision to actually dislodge some of that from your fatty tissues into the bloodstream or into the urine or into the feces or the fecal matter, and then test it. So once you know what you have, then you can work with it, because to detox, you also need to know what it is that you're detoxing. A lot of the really heavy metals, they're lower in the chart, are more difficult to get rid of unless you get rid of some of the lighter heavy metals. So there are protocols in which to do this. But, okay. I'm going to continue then, and we're going to talk a little bit about oral disease and systemic disease. And what's interesting with a lot of the research that's coming out lately is that they have found that the same bacteria that you have in gum disease, in some decay, sometimes in root canals, that bacteria doesn't stay in your mouth. It actually has access to the bloodstream. And so that bloodstream is actually carrying this bacteria to different parts of the body. A lot of it, really, a big problem is gum disease. And this is something that you really need to be aware of, because the gum disease actually is hosting a number of anaerobic bacteria, oxygen-hating bacteria in there. That's why they hide inside the gums, because they hate oxygen. So they're in there doing their thing. So, this is a more advanced case where you could see the gum disease, the inflammation, and there's usually pockets right in between. So, I don't know if I can get, well, you can see clearly, there's a periodontal pocket. It's the space between your tooth and your gum. That is a critical piece of information for you. If you have 2 or 3 millimeters of space between your tooth and your gum, you can actually get in there and clean it with your toothbrush. If you start getting more into 4, 5, 6 millimeters, now it starts becoming impossible to really clean this area with a toothbrush. So up to here, I can go with a toothbrush. Down here, this is untouchable. This bacteria right there are as happy as could be. They're throwing a party 24/7. So what's happening with that? More inflammation, more bacteria, and our bone starts coming down, creating even more pocket depths. So this is one of the most critical things that you can do for your health, is to check to make sure that you don't have deep pockets that are hosting a lot of anaerobic bacteria, oxygen-hating bacteria. Interesting that the same bacteria that have found in pockets and in some decays, in some root canals, have been found in the heart of people that have been ill with heart disease, and on pancreatic cancer. There's some really good solid research done by some respected institutions that have found the same type of bacteria in the mouth and in some of these life-threatening diseases. So what do you do about periodontal disease? And a lot of people have that. Some of us are aware of it, some of us are not aware of that. Obviously, traditional is brushing. Make sure that you use your toothbrush, a soft toothbrush, just with water, and you actually introduce them in the pockets and clean them. And then after that, if you want to use toothpaste or whatever for your teeth, that's fine. But you really should spend the time with water and a toothbrush physically removing. And this is only going to remove the first 2 or 3 millimeters worth of bacteria, right? Now, this is something that I've actually been promoting for a long time. I thought I was the inventor of this, but when my son went to check this, there were like 500 other people that had been using this irrigating devices and ozone in one form or the other. So I guess I wasn't so smart anymore. But this is something that I really work with my patients a lot, and I really highly recommend this as a much enhanced way to do your oral hygiene. What you do is you actually purchase a water pick, which you can purchase basically at any store, any major store will carry them, Costco, Target, any of them will have it, which is very, very modically priced. And you start using a water pick. What the water pick will do is the water pick will actually access more than 3 millimeters. It'll access the 4 and the 5 and the 6 and the 7 millimeters if you actually get that water pick in between your tooth and your gum. So now we're doing some physical removal of that bacteria. Is this more important than going to see your dentist for gum disease? Well, don't quote me on this, but yes. Why is this more important? Of course, it's important to go every 6 months, get your pockets checked, and get everything cleaned out. Of course, it's very important. But this you can do every day. I can't come to your house. I would love to if you invite me, but I can't come to your house every day and clean your pockets out. You can. You are your best dentist. Now, when you start introducing an ozonator, an ozone generator, and actually bubbling the ozone into the container of your water pick, and using that water into your gums, now you're taking O3 and hitting this anaerobic bacteria, which hate oxygen, which die on contact. So here you have, without chemicals, without having to pay for a lot of expensive mouth rinses and medicated and chemically filled washes, you can actually kill all the bacteria, all the anaerobic bacteria that is causing all that disease. So we found this a tremendous help in our own practice. I've kept a great number of patients from going to periodontal surgery, to a periodontist, and they're able to maintain it. Because in essence, what does a periodontal surgeon do? They actually cut the pockets to make them 2 or 3 millimeters again so you can clean them. That's basically what they do. I mean, they also will go in there and reshape the bone underneath and so forth. But really the bottom line is they're just creating a situation where you can maintain it again without all this bacteria. So by using an ozone machine and a water pick, you're enabling yourself, empowering yourself to do this and keeping yourself from really having a lot of gum disease, which affects your body. So some suggestions about the ozone. Use it in a well-ventilated area because ozone in the air is highly irritating to your GI tract, but in water, it's perfectly safe. The kind of ozonator that you want should have this specific specifications. Should be a coronal discharge, preferably 1,000 milligrams per hour, because otherwise you're going to be sitting there for 2 hours ozonating your water. With 1,000 milligrams, you will actually ozonate your water in maybe 10 minutes. So you just put it in there, go do something else, 10 minutes later you come back and you use your water with your water pick. And you want a sealed box around the elements. You know, there's some people on the internet that are actually making their own machines. You know, I'm a little suspect of that. I actually had my son, who has a company, source this particular, so if you don't find it anywhere else, you can always go to this website and get it. I'm not encouraging you to go buy it from him, but you know, if you find it somewhere else with those specs, I think you should get one. It's wonderful for your whole family. Let you read that yourselves. Then, of course, you know, you want to go to your dentist to make sure that he's probing. And if your dentist is not probing your teeth when you're going to see him, I would probably either ask him to do that or go to somebody that will do that for you, because this is a critical part of maintaining your health. The other thing is that people don't realize, but crowding on your teeth actually creates a lot of gum pocketing and gum disease. So that's something that you might want to consider. You know, braces were not for adults for a long time, but nowadays invisible braces are great, and you know, about 80% of my braces now are going adults. So that's something not just for aesthetics, but if you have a lot of crowding, that's really promoting a lot of gum disease. So something for you to think about. A lot of the times my patients ask me if the trays that you use for Invisalign or ClearCorrect, which is a competitor, if they are BPA free, and they are. Okay, questions about this segment? Yes?
You're recommending that you don't have to have gum disease to use the water pick?
No, you don't. You have to. You can keep yourself from getting diseased by using the water pick and the ozone. Most of the bacteria that cause problems in the mouth, decay and periodontal disease and endodontic problems, all of those bacteria are anaerobics. You see, actually, there are studies where they show the combination of aerobic and anaerobic bacteria in our mouths. When there's disease in the mouth, the anaerobics just take over. So by actually maintaining the populations of anaerobic bacteria in the mouth down, you are keeping disease down. So yeah, it's not only when you're diseased, prevention is obviously the best answer.
I understand the crowding of the teeth that you was talking about a few minutes ago. What about when you have gaps in your teeth? Does that open up for?
Gaps in your teeth are not as problematic,
Okay.
unless you have a very small gap in between the teeth where you're getting food trapped. If you have large gaps, there's some people genetically just have large gaps in between their teeth. That's usually not a problem at all for gum disease. And you'll know if you have your dentist probe you, If you have a pocket there, it's a problem. If you don't, it isn't, basically. But it's only when there's very narrow spaces between the teeth where food is getting trapped and actually impacting the gums that it becomes a problem. Yes? Oil pulling is wonderful. I think it's a great therapy, and it's been used for a long time. I'm very pro it. I actually, because of the great results that I've had with ozone, it actually is, I think, the treatment of choice in my eyes, in my view.
The question
Sorry.
was, how do you feel about oil pulling? Does everybody know what oil pulling is? It's where you put like a tablespoon of organic oil, oftentimes it's organic olive oil or organic coconut oil, whichever one you prefer, and you keep it in your mouth and you swish it, vigorously through your mouth for up to about 10 to 15 minutes even. I mean, some people do it for less, but to really get the effect, it has to be, I believe, for at least 10 minutes. And that's pulling a lot of toxins out. Then you spit it out and you make sure you get every last drop of it out of your mouth because you don't want to swallow any of that back down. That's oil pulling.
So oil pulling is actually quite good, and especially if you have metals in your mouth and things like that, it's actually beneficial. But really, a lot of the toxins in the mouth are produced by bacteria. So if you're really taking care of the bacteria, you're really taking care of most of the problem. Now, having said that, I use my own homemade prophy paste in our office, and I encourage my patients to make their own toothpaste at home. And this toothpaste has a base of virgin coconut oil. We use that, and then we use a few other things, natural ingredients into that. But the base of coconut oil gives you exactly the same kind of effect, especially if you brush for a prolonged period of time. It would be like a short mini oil pulling session.
There's a question from the live stream, Dr. Vinograd. It says, where do you buy the ozonators? Now, I assume that means if you already have, say, a water pick and you want to add the ozonator to that? Was that something
They're actually exactly two separate purchases.
Okay.
One is the water pick and the second is the ozone machine. I actually put a website where you can actually buy it, but I encourage you to just go on the internet and look for one that has the characteristics that I've described. Yeah?
I was just wondering about hydrogen peroxide. You said oxygen?
Not nearly as effective as the ozone. Ozone is O3. It's quite a bit more concentrated, and it actually kills bacteria on contact a lot more effectively. And you don't have to be purchasing hydrogen peroxide for the rest of your life. You just buy your machine once. I've had my ozone generator for about 25 years.
How do you make your own toothpaste?
You know what? I'd be happy. I actually give the recipe to all my patients when they come in and get their prophies. But I will actually, I have posted it in our blog. And
You know what we're going to do when you get next week when we send you the link to the website to go to so that you can watch this for an entire month again. We're going to include the link to his slide presentation for you. And we might actually get his recipe to send you.
I can actually make it available to you guys, and
Great.
it's also on my blog. If you go to drvinograd.com, I have it there, and I actually wrote an article about toothpastes. And if you want to see what they're putting on your toothpaste, it's kind of like a Halloween story. It's kind of scary. Okay, so we're going to move on, and I'll take some more questions at the end as well. A root canal controversy. This is the biggie. This is the mother of all questions, at least in my practice. Doc, I actually just had a lady contact me from Toronto, and the doctor, she went to see a naturopathic doctor. She had 8 root canals, and they wanted to extract the 8 teeth. And so, you really have to start thinking. You have to really start using your head when you're going to make a decision like this. Are root canals a problem? Do we leave it? Do we treat it? Do we extract it, right? And what I was talking about before in the internet, getting a lot of information, and there are patients that come to me and says, Doc, I heard root canals are the greatest evil in this world. There's just nothing worse than a root canal. I want you to take my tooth out. And ultimately, I will if I understand that the patient understands what they're doing. If they have all the facts, and then I can make a decision with him based on intelligent information. Because I'm not going to be making the decisions for them, that unless it's something that I don't feel comfortable doing, that are going to impact their lives. I think you have to make the decisions that are going to impact your lives, having good information. So let's talk about what a root canal is. Basically, the pulp, which is a combination of a nerve in some vessels, a vein and an artery, run through the inside of the tooth. Now, when there's decay, and the decay actually invades the nerve, that nerve becomes diseased, it becomes infected, and then we have to decide what we're going to do with it. So let's go back. So what do? In the past, people have gone in there, they create a little perforation on the top of the tooth, go in there, remove the pulp, the nerve, and it really is a very painless procedure. It sounds awful, but it's really a painless procedure, at least in our office. And then you actually enlarge the canals a little bit, clean them out, disinfect them, and then you fill them with material. Now, in a perfect world, if you could fill them and seal them, you would have a viable situation. What has given root canals such a bad name is that 99% of all root canals being done today are being filled by gutta percha, which is a rubber, with some sealant, like a paste that hardens, and a few other pieces of rubber. Some of them use heat to melt the rubber. Some of them just will actually condense it and push it to try to get some kind of a mass to fill that area. All of that has been terribly inappropriate and insufficient to really create a proper seal. First of all, the sealers that have been used are very toxic. And secondly, by both of these methods, you cannot really get a good seal where you don't have voids. Now, those little voids, mini voids that you get by doing a traditional root canal is what creates the problem, because when you have those little voids, they get invaded by bacteria, anaerobic bacteria again, that are, there's no way to get them. Once they get in there, how do you get them out, right? So that has been the problem in the past. People say, well, you have a dead tooth and a lot of other things. Well, not totally. It's a functional tooth. You still have blood supply from the outside. Do they get more brittle? Yes. Is that a perfect situation? No. But you have to understand, what is this? How is this going to impact your life? My advice to this lady from Toronto that called me, I said, you know, send me your x-rays, I'll look at them. I saw the x-rays. There was one particular tooth that I felt was not a really good candidate for a root canal. I said, why don't you extract this tooth, have the dentist put some kind of an organic material to maintain the bone quality, just in case you want to change your mind later and put something in there so that you don't lose all your bone. And then go for 3 months and get a feel for what it is to live without this tooth. Then multiply that times however many teeth they want to take out, 7 or 8 teeth, and see what the quality of your life is going to be. What is the quality of your life going to be with a removable denture? You know, our quality of life impacts our health too. So the decisions to go black or white sometimes are not the best decisions. We have to really see how immune compromised we are, what the situation is, what the quality of life is going to be post-decision, and so forth. So again, just have good information to make your decisions, yes? So options to replace extracted teeth. Let's say you decide to get rid of the tooth. You can, well, that's if we decide to actually extract it. So we could do an implant, and there are a couple of different kinds of implants. There are implants mostly that are made of titanium. And recently, from Europe, some dentists have been importing a new technology in which they're doing zirconia implants. I don't do zirconia implants in my practice because I think they still have a lot of challenges. They're still, they're one piece, They're very large, they're very invasive. So I don't feel that they're just where we needed them to be yet. You can use a fixed bridge to replace the missing tooth. You can use a removable bridge or a Maryland bridge. Here is an implant. What is an implant? Basically a piece of titanium gets embedded on your bone and a crown gets placed. Is that perfect? No. Is that something that you have to think about twice before doing? Of course. But again, you know, they integrate well into the bone, but it is some metal in your bone. You know, there's no way around it. People are going to try to sell you, this is the right answer, this is good, this is bad. There's no good, there's no bad. It's what's right and what's wrong for you. Removable bridge, for some people, successful. They don't mind. People have a lot of tolerance. They put that in, out. They're comfortable. They feel good. Probably from a biocompatible point of view, one of the best answers. From a lifestyle point of view, one of the worst answers. It's very, very difficult to have good quality of life when you have this thing in and out of your mouth. Fixed bridge. Now we can actually do very nice fixed bridges without any metal. Advantage, you replace it. It's very biocompatible. But disadvantage is that you have to grind the two adjacent teeth. If you have two adjacent teeth that are kind of broken down, have fillings, then it's a no-brainer. If you have two virgin teeth, nice quality teeth on the two sides of that tooth, I would really think twice before I go ahead and grind those teeth down. And then a Maryland bridge, which is a much more conservative 3-unit bridge, where you don't grind the adjacent teeth quite as much. Very nice compromise, but it is a compromise because those bridges tend to get dislodged, so every so often you have to get it re-cemented. So again, magic pill isn't here, and I'm not here to give you a magic pill. I'm just giving you facts so that you really can make good decisions again, and that's the design of a Maryland bridge. Now let's talk about the root canals, biocompatible root canals. I really stopped doing root canals for about 20 years because I just saw what was a root canal and how, what a really a poor job a root canal was doing in really sealing off the canals and preventing biological invasion. Today, there is a material called BC Sealer, which is a calcium-based material, which is a very biocompatible, osteogenic, which means it actually helps bone being laid out, that is being used in a lot of parts of the body to actually stimulate bone growth. And it's also hydrophilic. This is the key. Hydrophilic means that they like moisture. And so what does a material do when it likes moisture? With slight moisture, it tends to absorb a little bit of moisture, and when you absorb the moisture, it expands. So it expands, and it creates a much better seal. The other advantage of BC Sealer is that it has a pH of 12.4. No living organisms survive 12.4 pH for very long. And this material actually takes 48 hours to set. So it's actually actively disinfecting the canal for 48 hours. So now I'm doing, again, biocompatible root canals. And so far, in 7 years, I've had 0 failures so far. I mean, I may have had some that I don't know about, but they've been quite. Now, having said that, if I have a person that has a lot of challenges, you know, cancer, some systemic challenges that are very serious, would I consider extracting a tooth and not doing a root canal? Of course. I may want to do that for a patient that is immune compromised. If I have a very healthy patient that is not immune compromised, and this is a particularly important tooth, where having that tooth out is going to create a lot of challenges in your lifestyle, in your quality of life, I would not hesitate to do a biocompatible root canal, my opinion. So again, you're going to hear a lot of pros and cons, and you still may disagree strongly with me, but at least now you have some idea of what's available and what the problems are with root canals. Okay, and again, you know, it's your responsibility to take your health into your own hands. And I know I don't have to tell you this, just you guys are here. right? This is the wrong group to be preaching that to, absolutely. You guys are the exception. You're the cream of the crop. You are aware. So I don't have to remind you too much about the fact that in the last decade or so, corporations have basically taken over the decision-making process in this country and in the world, where I don't know if anybody saw this documentary called Corporation, right? Corporations, their only requirement is to make profits for their shareholders. There's really nothing that says there that they have to be moral, that they have a responsibility to the greater good, nothing. So legally, they actually have a responsibility to make money before they have a responsibility to create a good product or a healthy product. What does that mean? That we have to really make decisions now for ourselves. And so there are a great number of people out there that are going to help you do this. There are a lot of very committed people. I often go to missions down, dental medical missions in Guatemala and Central America. I meet some amazing doctors, amazing dentists with the heart in the right place. So people are out there to support you, people that are there doing the right things for the right reasons. Your job is to find them and to make them part of your network. And again, this is my personal website. You can get a lot of information there. Personal website about not just dentistry, but how I grow my own fish and my own vegetables and how I make my own toothpaste. A little bit more of a personal website. Actually, my son built that website for me. I told him that's a great memorial. I can die now and leave something behind. And then there's our office website and personal email if you guys have some questions. And of course, I'd be more than happy to communicate with Gerson with any questions that you might have. You can ask them through the Gerson Institute.
Do you have time for just a few in case
Yeah,
on that
absolutely.
last section?
Absolutely. Please. Yeah, speak up because the drill over the years has actually taken a toll.
So you have a root canal
Yes.
with a tooth broken off,
Right,
and it's kind of deep.
right,
But you want to get rid of the tooth and put in a fixed bridge.
right.
How long would you wait for that to heal before you would do that?
Well, in our office, what we do is we extract the tooth, we prepare the adjacent two teeth for a bridge, then we put a temporary, and then we wait from 6 to 8 weeks with a temporary bridge in place for that area to heal.
Cool.
The reason you want to put a bridge there is because as soon as you extract the tooth, teeth tend to collapse into the space. So you want to actually stabilize that area first, but you don't want to make that bridge prematurely. Otherwise, you're still going to be healing underneath the bridge, and you'll have a gap in between.
And how hard is it to pull the rest of that tooth out?
Well, it just depends how much experience you have.
Yeah. Okay, thanks, man.
Yeah, we're going to send it.
Okay.
Okay, I'm sorry, could you raise your hand? There was another one over here someplace that I...
Gold inlay, what are the complications with that?
Gold has been a material that's been used over many, many, many years. It's a good material. It's more biocompatible than many other things. But you have to realize that gold is not pure gold. If you use pure gold in your mouth, it would be wonderful from a biocompatible point of view. But pure gold is too soft. So the gold has to be mixed with copper, with tin, with a few other things. So it's still a good option. I would say that today Bruxer inlay would be more biocompatible, a better solution altogether. Does it mix well with everything? The Bruxer? Yes, because it's basically not a true metal. It's just a porcelain piece. So yeah, it would.
Can you just repeat what he said? He was asking if...
Would it mix well with gold?
Right.
Or other metals in the mouth, right? Yes.
I have a dentist, like what you mentioned at the beginning, that he's just a business, big money maker. But I'm looking for a dentist that is more economical so that this can get done. Does your website mention resources in different cities in this country?
It doesn't, and I really don't know enough good dentists everywhere to recommend them. I know a few, so you can always email me and I'll see if I can help you out with that. But most importantly, ask questions, see how people are doing, look into people's hearts, see why they're doing what they're doing, and then take responsibility. Take this information and make sure that the dentist is applying a lot of these basic concepts in the way they're taking care of you.
Do you recommend that people go to the IAOMT as a starting point?
It's not a bad place. Most of these places where they list dentists, all you need is to pay dues and become part of their group. So unless you've done something really wrong, they kick you out. So it's not a bad place. It'll kind of weed a lot of dentists out.
Right.
And at least the dentists that have this kind of vision and are trying to work within the parameters. But that does not guarantee that you're going to get somebody that is actually truly biocompatible.
But you could start with a list from that in your area and then go from there.
Absolutely, and then you can go interview the dentist, but I would still interview the dentist.
Regarding the BCC sealer, or is it just BC sealer?
BC sealer.
It's BCC?
BC.
Oh, just two, okay.
Is BC for biocompatible. It's actually not biocompatible, it's bioceramic, but
okay.
you can remember by BC
Okay, well, I have a
biocompatible.
quick question about that. That's for root canal, but is that something, since it's new and it's not as harmful as others, is that something that they can use on children's sealants, because they're putting sealants on young kids to keep it from getting cavities on their molars?
No.
No?
This is strictly for a root canal. This is really not strong enough to withstand masticational forces. So you use it inside the canal, and it's very good at sealing the canal, but it's not something that you could use instead of sealants.
Is there one that's better than another I can ask for?
Yeah, again, when it comes to sealants, if they're not placed properly, sometimes sealants are worse than no sealants at all. I've seen often sealants coming undone and a lot of decay getting in between the sealant and the tooth. So you have to make sure that they're placed properly, number one. And number two, all sealants are basically composite resins. So you have to go back to what we talked about. Which composite resin do you want to put in there? The one that has the BPAs or the one that has the small amounts of fluoride?
She promises this will be really fast.
Actually, to you or any other professional who can answer, I just wanted to know with the ozone machine,
yes,
can it be used for other purposes other than just the importance of, yes?
Yes, yeah, an ozone machine can use for multiple purposes. People use them to disinfect rooms, to their cars and whatever. I don't recommend that you use it for any purposes in which the ozone goes into the air, because it tends to create a lot of irritation on your respiratory tract. But once you place it in the water, you could actually use it for multiple things. Any place where you can actually use that to kill anaerobic bacteria, you could use it for. You could actually irrigate a wound with that.
If you already have a root canal with a toxic sealant, can you have it redone using the biocompatible, the same tooth?
Excellent question. We end up in our office doing a lot of retreatments, but really the key is often when you have had a root canal, often dentists will place a metal post in the canal to rebuild the tooth and then put a crown on it. We don't use metal posts, and a lot of dentists have given up metal posts because they found the metal posts actually end up cracking the roots and creating a bigger problem. So if you do have a metal post in a root, usually that tooth is unretreatable. If you don't have a metal post, depending on what they used, materials they used, it can be retreated. I find of the people that come to get retreated, about 65% of those teeth can be retreated. The other 35% are not. And be happy if you want to send an x-ray of your tooth, I can give you some feedback on that.
Well, we can't keep him here any longer. And he talked a lot about options, and I think probably you're all thinking two options. One, you're going to stick him in your pocket and take him home with you. And the second one is all you people from out of town are going to move to San Diego so Dr. Vinograd can be your dentist. Thank you so much, Dr. Vinograd. This was just terrific.
Thank you. I appreciate your time being here, and I commend you all. Thank you to the Gerson Institute. They're a magnificent institution.
And he is Dr. Smith's dentist, so you know she is incredibly picky. So.
Thank you very much.
Thank you so much. Oh, this is great. Can you help him disconnect over here? Hold on, yeah. Yep. You're not allowed to leave without turning in your evaluation. So we are at the end. And I just want to tell you, it's been so wonderful spending the weekend with you guys. I wanted to leave you with one thought also. And I'm not making this up when I tell you this. This is absolutely true. Right now, mental health professionals are actually treating people for a condition that they have created called orthorexia. Orthorexia, by definition, is someone with orthorexia is an individual with an unhealthy obsession with clean, organic, and healthy food. And they are actually prescribing psychotropic drugs to treat this condition. Again, I am not making this up. After you leave here this weekend, you may have contracted this problem with your mental health. But I just want to let you know that I would be thrilled to sit in the loony bin with every one of you, and we will all toast each other with a healthy glass of carrot juice. Again, thank you very much for giving us these few days out of your life. Be well, safe home, and stay bold.